My name's Katie McMahon and I'm going to be talking to you about Task 2 of my assessment. Question 1 was discuss 2 agencies or bodies you could access or engage with to facilitate positive health outcomes for your patients. Beyond Blue is an agency that I can access and engage with to facilitate positive health outcomes for my patients. Beyond Blue is a non-for-profit organisation that is working to address issues associated with depression, suicide, anxiety disorders, and other related mental disorders. They equip people with the knowledge and skills to protect their own mental health. They do this by providing factual information on the issues they are facing in a non-intrusive manner. There are many resources available through Beyond Blue, such as a 24-hour hotline where they are able to talk to trained professionals about whatever issues they are faced with in the past and present, whether they are suicidal, self-harming, in crisis, or emotionally unstable. Beyond Blue is not only for immediate help, they also provide people with information on the issues they are experiencing, how to understand it, and provide strategies on how to handle this issue in day-to-day life, without the stigma, prejudice, and discrimination that is often projected in society. There are also discussion groups that anyone is able to participate in. They can be from people in similar situations or who have the same disorder. Being able to contribute or read these discussions can help people to feel less alone and help them to see the others in their situations that have overcome circumstances, which can provide them with hope. Beyond Blue also helps people to seek the right professional support by helping them to obtain psychologists, occupational therapists, psychiatrists, as well as social workers and accredited mental health social workers. On the Beyond Blue website, people are able to assist with suicide safety plan or an action plan for when they are experiencing these issues. I feel that Beyond Blue is a great resource to use, as it has many options available to assist people of all ages, genders, ethnicities, and cultures. The Cancer Council is another agency that I would access to promote positive health outcomes for my patients. The Cancer Council is also a non-profit organisation. They aim to promote cancer control policies and reduce illness caused by cancer in Australians. They fund and participate in research to unlock more answers to cancer. The Cancer Council is able to promote positive health outcomes by providing both physical and emotional help to those who are affected by cancer or caring for someone who is. They have specially trained staff on their hotlines who work across every area of cancer and provide support. There are also support groups that they are available to participate in, which can result in a sense of belonging and community that can support and relate to each other. Cancer Council provides practical and financial support, such as providing transport and accommodation for regional patients that have to travel a long distance to receive treatment. There is also a free week service to promote self-confidence to people during treatment. This is why I believe Beyond Blue and the Cancer Council are effective in promoting positive health outcomes for my patients. Question 2. The wellness model of healthcare is the foundation for many non-Western approaches to health. The wellness model of health covers all aspects that can affect your health and well-being. This can be achieved through many non-Western approaches to health. Meditation is a form of a non-Western approach to health. Meditation can be used to aid mental health by reducing stress and controlling anxiety. It promotes mindfulness, improves sleep, enhances self-awareness, and lengthens attention span. Meditation is training your awareness to gain a healthy sense of perspective. It is learning to observe your thoughts and feelings without judgment. By using meditation in a contemporary nursing setting, it is able to aid people's health by giving them a way to assess what is happening to them and process it in a positive way. Question 3. Nursing theorists and theory. Number 1. Outline the key concepts of your chosen nursing theory. The nursing theorist that I align myself with is Sister Callista Roy, whose theory was formed in 1970. Her theory is the adaptation model. She believes that there are 5 interconnected essential elements. Number 1, patiency, the person receiving the care. Number 2, goal of nursing and adapting to change. 3, healthy being and becoming a whole person. 4, environment. 5, direction of nursing activities and facilitating adaptation. 2. I relate to Sister Callista Roy's adaptation model because I believe a large part of achieving care to its full potential is being able to adapt to what your patient needs and how they like things to be done. I find when I do this, the connection and trust between the patient and myself are stronger, and they are more willing to adapt to my needs when caring for them. I am able to maintain knowledge on nursing theorists with personal research via the intranet or nursing journals. 4. All healthcare settings in Australia must have in place a process of accreditation. 1. Define accreditation. Accreditation is a form of assessing the performance of an individual or group to ensure that they are meeting the standards of the organisation and the standards of their role. It is a way of implementing continuous improvement. 2. Define auditing. Auditing is a form of evolving from past practice to improve performance. The auditing process involves documenting what is being done in the workplace to evaluate the quality of care being performed. This evidence is measured against the established standards and the findings are evaluated. Through this, they are able to identify what actions need to be implemented to correct any issues and improve on practice. 3. List 3 common types of nursing healthcare audits. Hand hygiene is a really common healthcare audit, and usually all staff need to participate. By doing this, they ensure that everyone in their facility is aware of how to perform hand hygiene to minimise risk of spreading infection. Manual handling and mandatory training is another form of auditing, and it's another thing that everyone in the workplace must attend. Patient feedback and surveys. By having these done, it allows the facility to understand where they're going wrong, and then they can put steps in place to improve on that performance. 4. Example of how you'll be involved in auditing accreditation process in your nursing practice or training. I as an EN may at any time be included in an audit process by the NMBA to prove that I have completed the mandatory 20 hours of CPD each year. I am able to prove this by providing a portfolio documenting the education I have attended or the nursing journals I have read. As an EN student, a form of auditing that I will undertake is doing clinical assessments and sim labs to ensure that I am competent to perform the same actions in a hospital or facility. 5. Enrolled nurses working in an aged care environment. 1. 3 requirements of the enrolled nurse role unique to the aged care environment. Enrolled nurses within an aged care setting must be able to not only have knowledge of the anatomy and physiology, but also the effects that the aging process has on the body and each individual depending on their age and circumstance. I am able to access this knowledge by attending extra training and studying these issues that face aging people. Enrolled nurses have to be considerate in remembering that the elderly were raised in a different generation and may have a different outlook on life, acceptable behaviours and manners that were prominent in the past and have adapted to be something different in today's society. For example, some words that are used commonly now may have been regarded as blasphemy in the past. If nurses are unable to adapt to these differences, it may impact their ability to provide the best quality of care available for the aged. I am able to undertake additional training on these matters, as well as discuss it with the elderly themselves. Enrolled nurses within the aged care setting must also have knowledge on their role in palliative care, as this is one of the stages of aging as the health declines. If you're working in a nursing home, it is common for your workplace to provide training on this topic. Question 6. Reflective practice. 1. Define nursing reflection and reflective practice. Reflection in nursing is an essential skill that should be used regularly to assess situations and experiences in the workplace. The reflection process is used to improve job satisfaction and performance, enhance interpersonal skills, and comply with competency standards. 2. Outline and discuss one model of reflective practice. One model of reflective practice is the STAR model. S for situation is to assess the general context of the action, so what is happening and why. T for task, this is where you identify tasks in the situation that need to be accomplished. A for action, this is to explain what you did and how. R for result, this is assessing what result has occurred due to these actions. By using this model, you are able to break down the situation and improve on your practice in future circumstances. Reflection on your actions like this helps you to process what has happened in a calm manner without having emotions intrude as they can do at the time in the situation. 3. A brief reflection based on what I've learned from undertaking the study of practice in Australian healthcare system. Throughout this unit of practicing nursing within the Australian healthcare setting, I have had plenty of time to reflect on both the unit as well as my actions whilst completing the unit. During this time, I've had to establish new ways of thinking and processing to be able to understand and relate this information to the workplace. I have learnt how and why social, cultural, and social economic factors impact people's health, as well as how the wellness model of health is used to provide a wholesome quality of care. I have also learnt about how hospitals and other organisations are funded and the roles of the multidisciplinary team involved. I now understand what is required and expected of me as an enrolled nurse through the standards of practice, scope of practice, code of ethics, and code of conduct. I know that each workplace have different ways of performing these actions, and I am able to find this in the policies and procedures. I have knowledge on the history of nursing and how the past has influenced the way we practice today, and I am aware of the different forms of collaboration and how it improves quality care. I'm able to gain more knowledge on these topics as nursing evolves with CPD. Thanks, Della.